Hello, I am Leslie Houston, the Director of Institutional Accounts at High Yield Med Reviews, and with me today is Dr. Anthony Busti, our founder and editor-in-chief. Dr. Busti, thank you so much for joining me today.
Well, thank you for having me, Leslie. I appreciate it.
So we have advanced pharmacology curriculum support, and I wanted to take a few minutes to discuss integrating pharmacology across nurse practitioner programs because you have taught advanced pharmacology at nurse practitioner programs, and you were the pre-conference speaker at the NOPH conference the month that the new AACN Essentials were released. So let's start there. Can you tell me about the new AACN Essentials and what the change that it calls for how NP programs should be delivering pharmacology in their curriculums?
I mean, the fundamental shift was going from a kind of a time-based or focus-based approach to a longitudinal integrated approach to many of the core topics and things that are covered in a program that it also obviously includes advanced pharmacology. We all understand in managing patients, anybody with any real clinical experience, that you can't just read a book, take one class, and know how to effectively manage a patient. It requires that you establish a foundation, but that foundation needs to be built upon, and that's going to take some time. It also takes the integration of the content with real-world experience that comes through seeing patients in that clinical rotation environment that comes a little bit later in a curriculum. But connecting the two is really important at solidifying someone's understanding of how to apply the information in patient care.
I heard you say integrating and that pharmacology should be longitudinal, and I think that's the answer. But why do you think AACN is having nurse practitioner programs move in this direction, the new essentials calling for pharmacology to be implemented, and do you think this is a good thing or a bad thing?
It's absolutely a good thing. It's a good thing for the students who are putting their trust in the programs themselves. It's also good for the public, and it's good for the profession, because we're shifting away from a mindset of education where, again, time-based. You take a class, you finish it, you've passed it, but do you really know how to apply the information? That part is hard, right? So that's where we've shifted from a time-based curriculum to competency-based curriculum mindsets. And in order to do that, the programs now are being held a little bit to a higher level of responsibility to ensure that the graduates coming out, they understand the material, they know how to apply it. And so with that requires a more structured, integrated approach to the overall curriculum with all of these core topics.
Okay, so I mentioned we have advanced pharmacology curriculum support, and we also have something called clinical rotation support. So I frequently hear from NP faculty their concern about the differences of student experiences across different clinical sites. And do you feel like the new essentials will help address these differences?
I do, and let's just take a moment and talk about the differences amongst rotation sites, because it's not something that's inherently true within nurse practitioner education. I mean, I help train pharmacy students and pharmacy residents, medical students, medical residents, and including nurses, and across all the healthcare professions. That is a concern that the programs have. It's also something that students, especially when they're in the program, become aware of because they talk to their peers and they recognize, oh, you got to see that, I didn't get to see that. And that creates a little bit of, uncertainty for them. In addition to that, think about geographic areas even within a city, a state, or even a geographic location in a country. Patient populations are a little bit different, and with that comes differences in exposure. So if a student goes to one particular site over another site, they may see certain patient disease states or populations differently than another student at another location, and that is where some of the variations and inconsistencies start to arise that create problems a little bit, not only for student training at the end, passing their boards, but also preparing the nurse practitioner as a whole coming out of that program to effectively manage the patients that they're going to be taking care of. And the other reality too, just to add another point here that's important, is preceptors are under also constraints. I mean, they're committing to helping train nurse practitioner students coming to that rotation site, but they also have patients to take care of. So if the site is very busy, then they may also be pooled. So the school has a small concern with these variations. The preceptors have concerns with their demands on the real site. So that creates opportunity for us to be able to help, but it also creates a challenge for the programs if they don't have a solution for them.
So we have advanced pharmacology curriculum support. We also have something called clinical rotation support.
Yeah.
Let's talk application and implementation, because faculty frequently ask me how our clinical rotation support works. Can you tell us what rotation support is and how faculty might implement it to provide a more integrated and standardized experience for their students?
Yeah, so when we think about clinical rotation support in our program, it is literally a list of topics and disease states that are reviewed by faculty and kept up to date, some case discussions that build on earlier concepts that were taught in advanced pharmacology class in the previous year. So that's important to note. But it also allows then some flexibility. Okay, so think of it as like a textbook in a didactic course. I mean, we're all used to doing that. So students would come to the class, they get a syllabus, they are given a recommended textbook, and within that syllabus, they have a list of chapters, topics, and things that they have to go over that they're going to be held responsible for on the exam. But the curriculum as a whole is also doing that to make sure that all students going through this class walk out of that class with a certain amount of knowledge and exposure. The same concept and mindset exists in the rotation, except now we're not in the classroom environment, we're in the clinical environment. So these students are not just, they need to see patients, they need to see these disease states, they need to take some of the core knowledge that they learned in that advanced pharmacology course, but they need to now strategically build on that to apply it to the patients that they're seeing. Well, if you're not seeing certain patients or disease states, then where are you going to get it? Well, either the preceptor has to cover it, or the student is going to have to go and find something to learn and study on their own. And our program allows not only the school and the curriculum to either assign certain disease states to review on a rotation, or it gives the preceptor the option of saying, okay, I need you to watch this lecture or this video or this case to supplement what we discussed or saw in that case here. And that provides what the AACN Essentials are trying to accomplish, is this longitudinal integrated approach. So you solidify their knowledge to a level of understanding that leads to competency so that they effectively can manage patients well.
Well, thank you so much for your time today. Thank you for providing some additional clarity. If you are interested in continuing the conversation about clinical rotation support, I would love for you to email curriculumsupport@highyieldmedreviews.com. Thank you so much.